Hi, welcome back to UWorld's Next Gen NCLEX Review. My name is Samantha. I am a nurse here at UWorld, and I am so excited to be back today presenting a fundamentals question drill. So if you haven't been to one of our question drills before, it's pretty simple. We have 8 questions for you today. You'll drop your answers in the chat. I'll give you some time to read through, think about it, think it over, maybe phone a friend, and then drop your answers into the chat, and we'll reveal each answer. So we have Nurse Jackie standing by moderating our chat. So any questions that you have, any comments that pop up, and of course answers to today's questions, drop those in the chat. Let Nurse Jackie know, even if you just want to stop by and say hi. We would love to hear from you. And as always, keep those comments coming. All of these question drills live on our social media channels after we're done. So if you need to go back and revisit something, you can revisit it on any one of our social media channels. Personally, I find our YouTube the easiest to search. So with that being said, let's go ahead and get that chat started. Let us know where everyone is joining from. Are you coming from stateside here in the US? Are you an international viewer? Regardless of where you're tuning in from, we're so happy to have you. Let us know where you're tuning in from. And with that being said, we'll go ahead and get started. Alrighty, question 1. So here the nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. Option 1 is request a prescription for the intranasal influenza vaccine for the client. 2 is place a surgical mask on the client during transport. 3, remove the fresh flowers from the client's room. 4 is assign the client to a private room. And 5, instruct the client to bathe daily. Alrighty, drop those answers in the chat. Think it over. I see lots of people saying where they're from. People from Nigeria, New Jersey. We actually have some nurses right now, Nursing Coley especially, who are at the New Jersey Student Nursing Conference. So you're probably very close to them now. Ghana, UK, Zambia, welcome. We are so happy to have you guys. So keep those answers coming. Again, it's a select all that applies, so we have more than one correct option. And a reminder, we are partnered with NSNA, the National Student Nurses Association. Through the NSNA, we are doing a couple of really exciting special things. We're putting on some virtual webinars throughout the year, and those will help you guys prepare for the NCLEX. And we're also going to have a really large presence at both their spring and their fall NSNA conferences. So if you're not a member, consider joining. I believe dues are $27 a month last time I checked, to get access to all of these resources that we're going to be putting on through NSNA, especially if you can't join us in person in Seattle or Columbus for these conferences this year, you'll be able to join virtually. Alrighty, keep those answers coming. I'll give you a few more seconds, but it looks like you all are on the right track. I see lots of 2s, 3s, and 4s. A couple of you may have forgotten the 5, but our correct options are 2, 3, 4, and 5. So this client, as it states, is on neutropenic precautions. Clients who have neutropenia are at a high risk for developing infection. So what neutropenia is when neutrophils, or those mature white blood cells, are running really low. This can be an adverse effect from chemotherapy. It can happen with certain blood cancers, but since they have a harder time fighting off infection, we want to make sure we maintain infection protocol and keep them in the cleanest, safest environment. So this includes a couple of things. Placing a surgical mask on the client during transport. As you transport them through the hospital, you want to make sure they are safe from whatever germs and icky stuff is floating around. 3, remove fresh flowers from the client's room. Fresh flowers are beautiful, but they also harbor bacteria and fungi, and we don't want to bring that right into the client's room where they spend every day. 4 is a similar teaching point as with option 2, assign the client to a private room. We want to make sure that they are not dealing with anyone else's germs, bacteria, viruses, all those things. And lastly, 5, instruct the client to bathe daily. Hygiene is so important as a part of infection prevention, so we would indeed want to encourage this. So 2, 3, 4, and 5 were correct. Option 1 was that prescription for the intranasal influenza vaccine. So this is a live vaccine, which we never want to give to an immunocompromised patient. This would not fall in line with neutropenic precautions. So again, 2, 3, 4, and 5, y'all did really well on that one. Alrighty, question 2. The nurse is planning care for a client who has an indwelling urinary catheter. Which of the following interventions should the nurse include in the client's plan of care? Option 1 is apply tension when securing the catheter tubing to the client's inner thigh. 2, maintain the urinary drainage bag above the level of the client's bladder. 3, empty the client's urinary drainage bag when it's completely full. And 4, cleanse the client's perineal area with soap and water. Alrighty, drop those answers in the chat. I see someone saying they're taking their NCLEX tomorrow. Good luck, you're gonna do great. Stay calm, be confident, you can do this. If you haven't already, go ahead and follow us today. We hit 50,000 followers on our TikTok and our YouTube channels at the beginning of 2025. We're so excited about meeting this milestone. And on TikTok, I know we're almost about to hit that 60K milestone. So again, this is thanks to you guys and everyone who has followed us, subscribed, supported us. So if you haven't already, there is no time like the present. Go ahead and follow, subscribe, share this live. We're so happy to have you all here, and if you have people in your network that could also benefit from this, share so they're able to use it as well. Alrighty, I see that Brianna, I take the NCLEX next week, and I have been using UWorld. That's amazing. Good luck. You're going to do amazing. Alrighty, lots of answers coming in, and I see almost all correct options. So you guys got it, option number 4. So indwelling urinary catheter, we're looking, this again, question is asking us for interventions we should include meeting indicated options. So there's a couple important things to remember. Option 4, cleanse that client's perineal area with soap and water. It's so important to keep the area clean to prevent infection. A really big thing we're trying to avoid is a CAUTI, a catheter-associated UTI. And by keeping this area clean, making sure we're having proper hygiene, this is one of the steps we do to ensure that doesn't happen. 1, 2, and 3 were incorrect. We do not want to include these interventions in the client's plan of care. So applying tension when securing the catheter tubing to the client's inner thigh. I don't know if you have ever had a catheter before, but this is a very sensitive area. And if you're putting tension onto that Foley or whatever the indwelling catheter is, this is going to be very painful for the client. They are not going to be your best friend here. So you do not want to do that. 2 is maintain the urinary drainage bag above the level of the client's bladder. We want to go below the level of the bladder. This is so we allow gravity to do its thing, let that urine run down into the bag. If the bag is above the bladder, that urine is not going to be able to work against gravity and flow up into it. Option number 3, empty the client's urinary drainage bag when it's completely full. We do not want to wait until it's completely full. We want to do it sooner, probably around half to 3/4. We want to prevent the backflow and letting it be completely full, meaning it's going to push some urine back up into the bladder, have it backflow there, and we want to avoid that. So again, option 4 was our correct option. Alrighty, question 3. The nurse is screening clients for those at risk for developing pressure injuries. The nurse should recognize the client at highest risk for developing a pressure injury is the client who frequently slides down the bed, is experiencing constipation, has an indwelling urinary catheter, or 4, ambulates with a walker. Already dropped those answers in the chat. Let us know what you're thinking. And in the meantime, let us know which topics you all want to see us present. We've worked in a lot of mental health, a lot of pediatrics, a lot of OB lately. Those are always our most common recommendations. But if you have anything else you feel like we haven't covered or you want to see more resources on, drop it in the chat. Let us know what you're thinking. Maybe it's something we haven't covered a lot. I feel like it's been a while since we've done like GU and GI stuff. So if there's anything in particular you guys want to see, call it out in the chat. Let us know. I already see 2 pharmacologies coming in, so we will bookmark that and get it to you soon. That's a tricky subject though. I totally understand that one. Alrighty. Great job, you guys. I'll give you a few more seconds. Keep those topic recommendations coming as well. Pharm and psych, or psych pharmas too. Mental health medications are difficult. They also have a lot of really, really wild and severe side effects sometimes too. All right, and I see a lot of pharm today, so we're definitely putting that on the schedule. Okie doke. So you guys, it looks like most of you were getting at the correct option. We have a couple variants here, but most of you got correct with answer number 1. So again, we're looking at highest risk for that pressure injury. So highest risk means the client most at risk. We have a couple of risk factors for developing pressure injuries. First and foremost are going to be friction and shearing forces. Option 1, our correct option, frequently slides down the bed. This hits the nail on the head. What we're having here is a client that has the friction against those sheets, those shearing forces. That's going to be the number 1 cause of these pressure injuries, the biggest risk. Other risk factors include, of course, immobility, incontinence, poor nutrition or hydration, unrelieved pressure, the client's not being turned or moved frequently enough, and any comorbidities. One to call out would be diabetes, which we know delays wound healing. But our number 1 risk is going to be that friction and shearing force, which equates to option 1, frequently slides down the bed. The other one, experiencing constipation. This is the opposite of incontinence, so I don't know if this one really would apply. An indwelling urinary catheter. Again, this kind of hits on that incontinence point, but it's the opposite side. If they are having a urinary catheter, it means that it's going into the catheter and they're not being incontinent in the bed, which that wetness and moisture can lead to pressure injury. And again, 4, ambulates with a walker. If this client is ambulating, they're getting it up. It doesn't matter if they're getting up with a walker or with crutches. What matters is that they're getting up, getting out of bed. They're not sedentary and they're not immobile. So again, option 1 was our correct option. Way to go, you guys. Alrighty. So question number 4, the nurse is talking with the client who has a colostomy. Which of the following statements by the client would require follow-up? Option 1, I should avoid drinking coffee and alcoholic beverages. 2, I need to chew my food completely before swallowing. 3, I can continue to swim in the pool every morning. And 4, I will wait until my pouch is full before emptying it. Alrighty, and let us know, when do you all graduate? I feel like we had a lot of December grads recently. It seems like a lot of the people that graduated in December or in the winter are really at the end of that peak testing season. Maybe we have some spring grads, summer grads next December. Maybe we have some real early birds that are not graduating until next year. Regardless of where you are in your nursing journey, we're happy to have you. I see someone graduates May 2025. You're going to do amazing. That's so exciting. Someone says December. We're happy to have you here. Alrighty. Keep those answers coming, you all. So far, you have done spectacular today. Jazz says that her pinning ceremony is next week. That's so exciting. Congratulations. And someone else says they graduate on May the 18th. Very exciting. Right in time for summer. Alrighty. I see someone said they graduated 6 years ago. They moved to Canada and now they have to take the NCLEX. Okie doke. And someone graduated early December and they got their ATT a couple of weeks ago. That's exciting. I'm sorry you had to wait so long. Alrighty. So I see lots of correct answers. So I'm going to go ahead and jump to our correct option. Option number 4. So this is a little bit different. We have a requires follow-up question, meaning we're looking for our incorrect statement here. That's going to be our correct option because it requires follow-up. Some additional teaching is definitely needed here. So a colostomy is a surgical intervention. It brings the colon out through the abdominal wall, and the part that sits outside is going to be called a stoma. It's covered by a little plastic bag called an ostomy bag. That ostomy bag will be attached with an adhesive ring around the edge. It collects feces and gas. So instead of a normal person who would pass stool and gas through the rectum, it's being passed through the stoma. It's kind of like a shortcut, if you will. So this bag isn't very big. If you've ever seen an ostomy bag, they're really not that large. It fills with both gas and stool, so it can fill up relatively quickly. The more full the bag gets, the heavier it gets, which can be uncomfortable. It can show through clothing. It also is going to weigh on that adhesive. So we want to make sure we're emptying it when it's about a third full to prevent spillage, to prevent it from being weighed down. And we don't want it, of course, to detach from the skin or make that adhesive detach from the skin. So option number 4 would be incorrect. We don't want to wait until it's completely full. That's going to be very heavy. That's going to be very uncomfortable for the client, and it's going to increase the risk of spilling or detaching. Options 1, 2, and 3 do not require follow-up, therefore they were not our correct options. So the client should indeed avoid alcohol and coffee because these are irritants to the bowel. And again, anything that increases the risk of developing diarrhea can make the bag fill up quicker and need to be emptied more frequently. Option number 2, I need to chew my food completely before swallowing, also true. So food is not entirely broken down in these clients with colostomies because it doesn't travel through the full digestive tract. It's kind of like, again, I said, a shortcut. So chewing food completely will help with it being able to be broken down. It aids in its passage and makes sure that stoma does not get obstructed. So another correct statement. Lastly, 3, I can continue to swim in the pool every morning. Also true, as long as the ostomy pouch is intact, the adhesive is on, these clients are able to swim, bathe, or shower. Alrighty, I see someone said I read it wrong. This is so common. The biggest tip I can give anyone for their NCLEX is, nervous as you might be on the day, as anxious as you might be, make sure you read that question in its entirety so you know, is this a positively worded question that's looking for a correct answer, or is it a negatively worded question like this one that's looking for an incorrect answer? But good job on that one, you guys. Alrighty, question number 5. We are flying through this, but y'all are just doing so well. So the nurse is observing a staff member administer eye drops. Which of the following actions by a staff member would require the nurse to intervene? 1. Positions the client in the supine position before administering eye drops. 2. Cleans the client's eye from the outer canthus to the inner canthus before administering eye drops. 3. Gently pulls down on the conjunctival sac with non-dominant hand and instills eye drops with the dominant hand. Or 4. Repeats eye drop administration if the client blinks and the medication lands on the outer lid. I see someone asking if this is the same questions from this morning. They are. We do a double live on Thursdays, so these are the same fundamental questions from this morning. Keep those answers coming. I know a lot of you may see fundamentals and think, this is kind of easy, but personally I always found fundamentals to be difficult because very basic strategies and very basic interventions, I feel like become such muscle memory that the idea of having to break them down or describe them becomes very difficult on something that we see all the time that to us is so basic. I feel the same way about like crutches questions, which even though we know how to use them in theory, having to describe it and take test questions on it, it's kind of difficult to put that into words. So if you're struggling with fundamentals, just know you are not alone and we will get you there. Someone's asking about where can I find test strategies. We are actually putting out some really exciting test strategy information as part of our NSNA partnership that I previously spoke about. So if you want more test taking strategies, consider getting a membership with NSNA, and we're going to be putting out a lot of really great virtual and in-person content via NSNA about test taking strategies, the next gen NCLEX, next gen question like case studies, bow ties, drop downs, matrices, all of that good stuff. Alrighty, a few more seconds. You guys are doing great. Alrighty, I'm going to go ahead and pop to our correct option, which it looks like most of you got correct, and that was option number 2. So another negatively worded question: what requires the nurse to intervene? What is not correct and requires some follow-up and some education? So the nurse needs to intervene because in option 2, this staff member is doing something incorrectly. So cleans the client's eye from outer canthus to inner canthus. We're going to go from inner canthus to outer canthus. That's the correct way, meaning this one is incorrect. It's also always important to remember that when we're cleaning anything, it's the same principle as with like cleaning a wound. You always go from the area that's least contaminated to the most contaminated area, so we're not recontaminating that least contaminated area. That was kind of a tongue twister. But you want to go from the cleanest to the most dirty area. That way you're pushing out that contamination and you're not recontaminating an otherwise cleaner area. So in this case, the eye, that inner canthus typically will be cleaner than the outer canthus, so we go inner to outer, not outer to inner. 1, 3, and 4 do not require follow-up because they are okay interventions. So positions the client in the supine position before administering eye drops. This is correct. If they prefer to be seated, you can have them tilt their head back. That would also work. Option 3, gently pulls down on the conjunctival sac with the non-dominant hand and instills the eye drop with the dominant hand. Also correct. You always want to use your your dominant hand to do whatever the main intervention is, whether that's giving an injection, giving an eye drop, giving an otic drop. You don't want to use the medication with your non-dominant hand because that's not going to be as dexterous. 4 is repeats eye drop administration if the client blinks and the medication lands on the outer lid. This is also true. You want to make sure they get the medication so they're able to enjoy the therapeutic action of that medication. If it blinks, then they're not getting the full dose, and so we would need to reinstill that eye drop. Alrighty, good job, you guys. Again, number 2 was our winner here. Okie doke, question 6. So the nurse is preparing to administer insulin to a client. Which of the following actions should the nurse take? Option 1 is draw up regular insulin into the syringe first and then NPH insulin second. 2 is hold the insulin syringe with the non-dominant hand and pinch periumbilical skin with the dominant hand. 3 is clean the injection site with an alcohol swab and inject the insulin before the alcohol dries. And 4, check for blood return before injecting the insulin. Alrighty, let's see those answers. Let's see what you all think. In the meantime, if you have not already checked out our Nurse Life videos, go ahead and do that. You can access them on any of our social media channels. I think they answer a lot of really needed questions. I feel like in the nursing journey, from applying to nursing school, getting through your nursing school curriculum, surviving your clinicals, passing your NCLEX to becoming a full-fledged independent nurse. There are so many questions that pop up in the meantime that are just really difficult to find resources on. So we are trying to meet that need. We're trying to answer some of those questions, from what can I bring to my NCLEX, what's an ATT, to how do I renew my nursing license as an RN. So we're really trying to meet that need, answer those questions, and give you guys some more resources, and notably some more free resources in order to just help you out a little bit. Things are tough enough. We're trying to make them simpler. All right, I see lots of answers coming in. Also, keep letting us know, how are you all studying? What products are you using? Are you using a question bank? Are you using a video on demand source, flashcards, maybe some kind of workbook or worksheets? Are you going to live reviews? Let us know in the chat how you all are studying. Who here is using UWorld? We are always curious to find out. There's so many things that pop up every day, it's kind of hard to keep them straight. All right, so I see lots of answers coming in, and you guys hit the nail on the head. Option number 1 was our correct option. So we're looking again, this is a positively worded question. We're looking for the thing that the nurse was doing right, the action that is indeed correct, and that will be option 1, drawing up regular insulin into the syringe first, and then the NPH insulin. So there's a couple ways to remember this. I remember it as RN, regular, before NPH, and we're RN as registered nurses. Or I think the more common one might be clear before cloudy. So regular insulin is clear, and it must be drawn into the syringe before we draw up that cloudy NPH insulin to prevent cross-contamination. So contaminating the regular insulin with long-acting insulin is going to reduce the desired short-acting effects and potentially cause adverse effects like hypoglycemia when that NPH peaks. So again, clear before cloudy, R before N, that's how we're going to draw up that insulin. The rest of the actions are incorrect. So 2, 3, and 4 were incorrect. Hold the insulin syringe with the non-dominant hand and pinch periumbilical skin with the dominant hand as in option number 2. I think I brushed on this point in a previous question, but whenever we're giving a medication, giving an injection, that main medication needs to be in your dominant hand. It's more dexterous. If you try and give an injection with your non-dominant hand, you're not as dexterous, and you have a higher risk of a needle stick injury or injury to the client. So we're injecting with the dominant hand, and we're pinching the skin with the non-dominant hand. Alrighty, number 3, clean the injection site with an alcohol swab and inject the insulin before the alcohol dries. We need to make sure the alcohol dries in full so it can have its desired effect to kill those bacteria, but also if you ever injected over wet alcohol, it stings and it burns for the client, and they're probably not going to like you very much, so we want to make sure that alcohol dries. Option number 4, check for blood return before injecting the insulin. This is describing more something we see in an intramuscular shot or an IM shot when we aspirate. Insulin shots are subcutaneous or sub-Q shots, so this is a separate mechanism here. Again, option 1 was our correct option. Way to go, you guys. Alrighty, so question 7, the nurse is teaching parents at a community health fair about scoliosis. Which of the following information should the nurse include? 1, scoliosis affects only the curvature of the lumbar spine. 2, surgery is required to correct scoliosis. 3, screening for scoliosis begins in preschool. Or 4, scoliosis can cause unequal shoulder heights. Alrighty, drop those answers in the chat. Let me see what you all are thinking. I feel like scoliosis is kind of a more random topic. I don't remember covering this in very much depth in nursing school. So if this is tricky for you, no worries, you are in the right spot. And also an important point to drive home is that in 2024, the last quarter, so the last 3 months of 2024, we saw NCLEX rates, pass rates drop significantly. So in April of 2023, the next gen NCLEX was instituted, and we saw pass rates increase. Now we're kind of gotten to the top of that bell curve, and we're seeing them start to decline again. So what this means for all of our testers is that no longer is it okay to just wing it, go in with what you already know. You really need to make sure you are finding a reliable, a proven test preparation platform. You're putting in your hours to study, you're making a study plan, you're checking out resources, maybe lecture videos, maybe extra notes on any of the subjects that challenge you or that you need more help on. So again, now more than ever, with these NCLEX pass rates dropping, you all need to make sure you consider a test preparation platform. If you are thinking about winging it, I would strongly urge you not to. All right, lots of answers coming in. You all are the cream of the crop today. You're doing so, so well. And our correct option here, you guys got it, was option number 4. So which of the following information should the nurse include? So this is a positively worded question. We're looking for a correct teaching point here. And scoliosis can indeed cause unequal shoulder height. So scoliosis, in a nutshell, it's a common spinal deformity. It, shocker, affects the spine as well as the shoulders and the hips. So it is one of the most common spinal deformities, and it's also characterized by the lateral curvature of the spine and spinal rotation. So scoliosis can result from congenital or pathological conditions, but it's also mostly idiopathic, meaning we don't know what causes it. It will commonly be noticed in periods of rapid growth, so growth spurts, so to speak, which will be that early adolescent age. So option number 1, scoliosis affects only the curvature of the lumbar spine. We just went over this, but this affects the spine, the shoulders, and the hips, so this would not be correct. 2, surgery is required to correct scoliosis. In some cases, surgery will be required. However, it can also be mediated with braces in some case, or a brace. So it's not just a one-size-fits-all, everyone needs to have surgery situation. And 3, screening for scoliosis begins in preschool. Again, screening for scoliosis is going to hit in those really heavy growth periods of early adolescence. For girls, it's going to be around 10 to 12, and for boys who mature a little bit later, it'll be more around 13 to 14. But again, those are all incorrect options, and 4 was our only correct option, which is causes unequal shoulder height. This is true. So again, option 4 was our correct option, and it's time to move on to our final question of the day. So the nurse is teaching a client with orthostatic hypotension. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. I think, is this our only select all that apply? Or I guess we had one earlier. But option 1 is perform carotid artery massage. 2 is decrease dietary sodium intake. 3 is apply graduated compression stockings. 4, implement a fluid restriction. Or 5, administer fludrocortisone. Alrighty. I see someone asking how many practice questions do you suggest taking daily? I think that's going to vary person to person. What I found helpful when I was studying was whenever you start, build up your momentum, build up your stamina. I think I started with like 15 or 20 questions a day right when I began studying, and then I increased it by like 5 or 10 questions a day. I don't think I ever did more than like 100 or 150 a day though. Alrighty, so keep those answers coming, and also after we're done with today's final question, let us know how many out of 8 did you all get correct? Did anyone here go 8 for 8? Who went 6 for 8? Again, like I said, fundamentals, even though you think they're basics, you think they're the simple things, a lot of this stuff becomes such muscle memory, that especially after you become full-fledged nurses, but may you even experience this as you work more in your clinicals, the basics, the muscle memory stuff, you become so accustomed to that it's kind of hard to describe the processes or break them down when you see them in words. So don't let anyone tell you that you're not allowed to get tripped up on the fundamentals sometimes. Okie doke. So I see lots of different answers where this one I think may have been the trickiest one so far today, and that's okay, we'll go over it in full. But our correct option here is going to be 3 and 5. So why is this? Orthostatic hypotension is going to be that positional hypotension. So when we change position, we see a lowering in our blood pressure. So if the client goes from a lying position to a sitting position, the blood pressure drops. If they go from a sitting position to a standing position, that blood pressure drops. So what we want to do, our interventions are going to be based around beefing up or bulking up that blood pressure to help increase it and counteract the drop in blood pressure. So a couple things we can do for this. Graduated compression stockings are going to be a non-pharmacological intervention, which we always try and do first. These reduce the pooling of blood in the lower extremities, help push the blood back up the legs and back to the heart and combat that drop in blood pressure. 5 is a pharmacological intervention. Fludrocortisone is a synthetic mineralocorticoid, I don't know why I can't say that mimics the effects of aldosterone. So it reduces sodium losses in the urine, and remember, wherever sodium is, water follows. So this is going to help us to increase our blood volume. We want to hold on to sodium. We don't want to lose it all in the urine, because the more we hold on to that sodium, it's going to draw water into our vascular space and help to beef up that blood pressure. So again, this is something we would do. 3 and 5 are our correct options. 1, 2, and 4 were incorrect. Why was this? So option 1, carotid artery massage is going to stimulate that vagus nerve, which we know can cause drops in our heart rate. We do not want to do this. Option 2, decrease dietary sodium intake. Like I said before, where sodium goes, water follows. If we decrease our sodium intake, we're going to be pulling less water into that vascular space, which is not going to help us beef up our blood volume, which is not going to help us increase our blood pressure. 4, implement fluid restriction, kind of a similar teaching point here, but we want to help pull more volume into our blood to help increase our blood pressure. And if we put these clients on a fluid restriction, this is going to be doing the opposite of that. So again, 3 and 5 are our correct options. Good job, you guys. Thank you so much for joining today. You all did so well. I know some of this was kind of tricky and hard to put into words, but make sure you come back next Tuesday at 12 p.m. Central Standard Time for our next live lecture section.